So what are the benefits of using a hyperbaric oxygen chamber? And specifically, what even is hyperbaric oxygen therapy, or HBOT? You may have seen this popped up quite a lot around the social media space, specifically seeing many other influencers, athletes, celebrities jumping into HBOT chambers, and they're all reporting benefits in terms of improvements in energy, recovery, and even potentially boosting the production of stem cells. So in today's video, we'll do a deep dive into the benefits of HBOT. And so first of all, we need to understand that hyperbaric oxygen therapy is a medical treatment where you breathe 100% oxygen in a pressurized chamber compared to the 21% of oxygen found in normal air. Now, this increased oxygen concentration allows more oxygen to be carried by the blood, enhancing oxygen delivery to tissues and organs. Now, hyperbaric oxygen therapy is commonly used to promote healing in conditions such as chronic wounds, radiation injury, and decompression sickness. Now, recently it has gained attention in the biohacking and health optimization space for its potential to support brain health, reduce inflammation, and accelerate recovery. So let's have a look at the history behind HBOT therapy. The history of hyperbaric oxygen therapy began in 1662 with Nathaniel Henshaw, who built the first pressurized room to treat pulmonary and digestive conditions. The first true hyperbaric tank was introduced in 1834, demonstrating potential for treating various medical conditions. The 1900s saw renewed interest as French doctors used hyperbaric oxygen therapy to assist surgery with fewer complications. Public interest surged in the 1960s when United States President Kennedy's sick infant was treated in a hyperbaric chamber, catalyzing research that contributed to the development of modern neonatal intensive care units and transforming the treatment of respiratory distress syndrome. A pivotal moment came in 1956 when Aite Boyarema, known as the father of hyperbaric medicine, published the first clinical paper on hyperbaric oxygen therapy. As the chief of surgery at the University of Amsterdam, Boerema initially focused on using hyperbaric oxygen during cardiac surgery to extend safe operating times. He and his team later documented hyperbaric oxygen therapy's efficacy in treating necrotizing infections and ischemic leg ulcers. Since then, extensive research has refined its applications, leading to scientifically validated guidelines for its use in a variety of medical conditions. So what is the mechanism of action? How does it actually help to heal the body and accelerate recovery? The mechanisms of action for hyperbaric oxygen therapy involve breathing 100% oxygen under elevated pressure between 2 to 3 atmospheres absolute in a hyperbaric chamber. This increases oxygen dissolution in plasma, raising arterial oxygen levels significantly. Tissue oxygen levels also rise and remain elevated for hours post-treatment. Beyond counteracting hypoxia, hyperbaric oxygen therapy acts as a potent physiological drug, redistributing blood flow with vasoconstriction in well-perfused, which means well-oxygenated areas, and vasodilation in hypoxic tissues. On a molecular level, it preserves ATP, modulates inflammatory pathways by down-regulating pro-inflammatory and up-regulating anti-inflammatory cytokines and growth factors, mobilizes stem cells, and exerts antibacterial effects by exploiting microorganisms' inability to tolerate high oxygen levels. It also enhances antibiotic efficiency by reducing leukocyte chemotaxis and increasing phagocytosis. Side effects are rare below 3 ATA and are reversible if oxygen exposure is replaced with pressurized air. Now, how is it related to FDA-approved treatments? Now, bear in mind, what we've seen here is approved treatments, but we are biohackers. We're specifically looking at biohacking therapies. So make sure you keep in mind that this is not medical advice. And so what I'm sharing here is the current FDA-approved treatment. So number one, we can see here, decompression sickness occurs when gas bubbles form in the bloodstream, causing pain. Hyperbaric oxygen therapy reduces bubble size, preventing tissue damage and aiding gas elimination. Gas embolism, air or gas bubbles in the artery block blood flow, causing dangerous heart rhythms or tissue damage. Hyperbaric oxygen therapy reduces bubble size and supports absorption, especially in surgery or scuba accidents. Non-healing wounds, hyperbaric oxygen therapy helps wounds like diabetic foot ulcers heal by boosting oxygen, promoting new blood vessels, and reducing infection and swelling. It's used with standard wound care. Compromised skin grafts and flaps. Skin grafts or flaps may fail due to poor blood supply or infection. Hyperbaric oxygen therapy boosts oxygen to improve survival and repair. though it cannot revive dead tissue. Post-radiation tissue damage, hyperbaric oxygen therapy aids recovery after radiation therapy by promoting tissue repair and healing in damaged areas. Crush injuries and compartment syndrome. Hyperbaric oxygen therapy helps treat crush injuries and compartment syndrome by improving oxygenation, reducing swelling, restoring blood flow, and promoting healing. Necrotizing soft tissue infections. Hyperbaric oxygen therapy with surgery and antibiotics treats these life-threatening infections by increasing oxygen to fight bacteria and support tissue repair. Osteomyelitis refractory. Hyperbaric oxygen therapy is approved for treating bone infections resistant to standard treatments by improving blood flow, oxygenating tissue, and supporting immune response. Severe anemia. Hyperbaric oxygen therapy increases oxygen saturation to help manage severe anemia when blood transfusions aren't available. Thermal burns. Hyperbaric oxygen therapy aids healing of severe burns and frostbite by boosting oxygen, reducing inflammation, and promoting new blood vessel growth. Now, I want to take a look at how LeBron James actually uses a hyperbaric oxygen chamber. Now, bear in mind, these treatments are not approved, but we're going to take a look at the science, specifically the claims that we're going to be investigating in this video. We'll be looking at the effects on cognitive function, mental capacity and alertness, sports recovery, drive oxygen to cells to remove waste and edema. We'll also be investigating other biohacking uses such as cancer, gut health, Lyme disease, and anti-aging. So let's have a look at this video.
So it's a portable hyperbaric chamber, and the main idea of it is to help drive oxygen throughout the body, and you're obviously at a higher pressure within the bubble there. And the idea of that pressure across the cell level helps drive, oxygen, deeper into the cells and deeper in the body, and be able to remove, waste and edema. It can help even with mental capacity in terms of your alertness coming out of there. For athletes, it's a kind of a no-brainer if you can kind of have the time and the investment to use it. And he'll be in there for about an hour and a half, which is probably about the optimal time to be in there for.
10 o'clock, Steve-O.
10 o'clock, you got it. He's enjoyed using this thing, especially during this time of year where every little edge counts.
So let's analyze the first claim, cognitive functioning in healthy adults. Hyperbaric oxygen therapy has been shown to enhance cognitive functioning in healthy adults by increasing oxygen availability to the brain. One study demonstrated that episodic memory, including learning resilience and memory retention, significantly improved in individuals receiving hyperbaric oxygen therapy compared to a sham treatment, highlighting oxygen as a rate-limiting factor for memory performance. Another study found that multitasking performance as well as single cognitive and motor task efficiency was significantly enhanced in a hyperbaric environment, suggesting that increased oxygen supply supports the brain's ability to perform complex tasks by optimizing resource allocation across regions. Additionally, a functional MRI study revealed that hyperbaric oxygen therapy increased activity in memory-related brain areas, such as the hippocampus and inferior frontal gyri, which correlated with improvements in spatial working memory and overall cognitive scores, providing neural evidence for the observed cognitive benefits. These findings underscore hyperbaric oxygen therapy potential as a tool for cognitive enhancement in non-clinical populations and support the claims of LeBron's coach. Let's take a look at how hyperbaric oxygen therapy may also impact disease states related to cognitive function. What about mental functioning and alertness reaction, specifically for stroke? Now, this is not medical advice. So this retrospective study looked at 162 post-stroke patients, all in the chronic stage of recovery, meaning that more than 3 months after their stroke. These participants underwent a treatment protocol of 40 to 60 sessions in a multi-person hyperbaric chamber. Each session lasted 90 minutes at the 2 atmospheres of pressure with breaks of regular air every 20 minutes. Across all domains of cognitive function, like memory, attention, and processing speed, 86% of the participants showed clinically significant improvements. That means their cognitive function improved by more than half a standard deviation, which is a meaningful change. The type, location, and site of the stroke didn't seem to matter much in predicting improvement. This research suggests that even in the chronic stage when recovery often slows down, HBOT could still make a significant difference in brain function. Interestingly, in this recent systematic review and meta-analysis which combined data from 8 randomized controlled trials involving 493 patients, the findings were mixed. HBOT didn't significantly improve common clinical measures like the Barthel Index, which measures daily functioning. It also had no notable impact on inflammation markers like TNF-alpha, and C-reactive protein was trending towards significance. However, there were some encouraging results. HBOT significantly improved the modified Rankin score, a measure of stroke-related disability, and patients receiving HBOT experienced fewer adverse events by the end of their treatment compared to those who didn't receive it. So what does this mean? While the routine use of HBOT for acute ischemic stroke isn't supported by current evidence, the reduced adverse events and disability scores suggest it might hold promise in specific cases. More research is needed to figure out how timing and stroke type might influence its effectiveness. Now, what about specifically as it relates to traumatic brain injury? This meta-analysis examined the effects of hyperbaric oxygen therapy on traumatic brain injury, comparing outcomes between HBOT and control groups. The analysis included 8 studies focusing on patients with mild to severe TBI and assessed outcomes using the Glasgow Coma Scale, Glasgow Outcome Score, mortality rates, and post-traumatic stress disorder scores. The findings showed that HBOT significantly improved GCS scores with a pooled difference of 3.13 points, and also resulted in better GOS outcomes and lower mortality compared to the control group. However, there was no significant change in PTSD scores. Overall, the study suggests that HBOT may be beneficial in improving cognitive recovery and reducing mortality in TBI patients, potentially making it a valuable addition to intensive care treatment. This study also notes that there may be a delayed effect with hyperbaric oxygen therapy. Now, the second claim, sports recovery reaction here. So this study examined the effects of hyperbaric oxygen therapy on inflammation, oxidative stress, and muscle damage following exercise in both normal atmospheric conditions and low oxygen conditions. 18 healthy males performed 60 minutes of treadmill running at 75 and 80% of their maximum heart rate in either normal or low oxygen conditions. After exercise, hyperbaric oxygen therapy was applied. The results showed that exercise significantly increased markers of inflammation, such as fibrinogen and interleukin-6, and muscle damage, creatine kinase, and lactate dehydrogenase. Hyperbaric oxygen therapy effectively reduced these markers with notable decreases in interleukin-6, creatine kinase, and lactate dehydrogenase levels in both treatment groups. These findings suggest that hyperbaric oxygen therapy can help alleviate exercise-induced inflammation and muscle damage, potentially aiding recovery. Real quick, do you feel like your current supplement stack isn't quite cutting it? If so, then you might want to check out my brand new supplement, Catwa Pure. Catwa Pure is a remarkable, lesser known Amazonian herb that has been used for centuries to support energy, mood, and libido. Scan the QR code on your screen to discover how Catwa Pure can take your supplement game to that next level. What about some other potential benefits associated with HBOT, specifically anti-aging? This review article published in 2022 titled Hyperbaric Oxygen Therapy for Healthy Aging, From Mechanisms to Therapeutics, goes over the mechanisms by which HBOT may assist with aging and also summarizes key studies about findings from preclinical and clinical investigations. It indicates the following. We can see effects on angiogenesis, inflammation alleviation, elevation of antioxidant activity, suppression of cellular senescence, and also stem cell stimulation. So this is pretty remarkable. What about as it relates to Lyme disease? What evidence does HBOT therapy have against Lyme disease? Many websites claim hyperbaric oxygen therapy is effective for Lyme disease due to its ability to expose the anaerobic Lyme-causing bacteria, Borrelia burgdorferi, to oxygen-rich environments in which they cannot survive. This contrasts with traditional antibiotics to which the bacteria can sometimes develop resistance. However, the scientific support for this claim is limited. Despite anecdotal enthusiasm, only one published study has rigorously examined hyperbaric oxygen therapy for Lyme disease. A case report from Taiwan followed a 31-year-old man with chronic Lyme disease who experienced persistent symptoms despite years of antibiotic treatment. After 30 sessions of hyperbaric oxygen therapy, his neurological, musculoskeletal, and other Lyme-related symptoms resolved in stages with notable improvement after each set of 10 sessions. While this case demonstrates potential benefits, the lack of broader controlled research limits conclusions about its overall efficacy for Lyme disease. One noted side effect of hyperbaric oxygen therapy in Lyme disease treatment is a Jarisch-Herxheimer reaction, which also occurs during high-dose antibiotic therapy. As the bacteria die off, their toxins increase inflammation, temporarily worsening symptoms such as muscle and joint pain, cognitive impairment, and headaches. While unpleasant, this reaction often precedes symptom improvement as the body clears the toxins. It's also important to note that in a survey of Lyme sufferers, 22% of people found hyperbaric oxygen therapy to be moderately or very effective. Moving on, let's look at gut health, specifically IBD or inflammatory bowel disease. What effect does it have here? This systematic review and meta-analysis assessed the effectiveness and safety of hyperbaric oxygen therapy for various inflammatory bowel disease phenotypes. 19 studies with 809 patients were included, showing the following clinical remission rates: 87% for ulcerative colitis, 88% for luminal Crohn's disease, 60% for perianal Crohn's disease, 31% for pouch disorders, 92% for pyoderma gangrenosum, and 65% for perianal sinus metastatic Crohn's disease. Safety data indicated that 15% of patients experienced minor adverse events. Despite promising results, the study highlighted the low quality of most studies and called for well-designed randomized controlled trials to confirm HBOT's benefits for IBD. Now, moving on, we can see Crohn's disease. What effect does it have on Crohn's? Crohn's disease is a chronic inflammatory condition of the digestive tract, often linked to an imbalance in gut bacteria, known as gut dysbiosis, where harmful bacteria dominate and disrupt gut health. This study explored hyperbaric oxygen therapy as a treatment for Crohn's disease, focusing on its effects on gut microbiota and inflammation. In an open-label study, 20 patients with Crohn's disease were divided into a hyperbaric oxygen therapy group and a control group. Results showed hyperbaric oxygen therapy significantly reduced markers of inflammation, such as C-reactive protein, a blood marker of inflammation, and improved the Crohn's disease activity index, a clinical measure of disease severity. Hyperbaric oxygen therapy also enhanced gut microbial diversity, increasing beneficial bacteria like Bifidobacterium and Clostridium stethia, while decreasing harmful Escherichia levels. This can be seen in this table. Fecal microbiota transplantation, transferring gut bacteria from one individual to another from hyperbaric oxygen therapy treated patients, reduced inflammation in a mouse model of colitis. Now, cancer. Specifically, this is not medical advice, but HBOT is also being increasingly researched as an additional therapy for cancer treatment. However, it is really important to note that there are challenges in HBOT clinical use and research is still emerging. We do need further preclinical and clinical research to ensure that the safety and efficacy of HBOT in cancer treatments. So let's take a look at the research. In this mini review article published in 2024, the authors highlight that hypoxia in the tumor microenvironment is a critical barrier to effective cancer therapy, as it promotes resistance to treatments like radiotherapy, chemotherapy, and photodynamic therapy by inducing factors such as HF1A expression. While various strategies to alleviate hypoxia remain in preclinical stages, the authors note that hyperbaric oxygen therapy is emerging as a potentially effective clinical approach to enhance treatment efficacy by delivering oxygen to hypoxic tumor regions unreachable by red blood cells. They note there have been some clinical advancements demonstrating hyperbaric oxygen therapy's potential in combination therapies, such as its ability to significantly reduce tumor size and improve survival in upper gastrointestinal cancer patients when combined with photodynamic therapy, or enhance outcomes in glioblastoma treatment when integrated with radiotherapy and chemotherapy. However, the authors also emphasize challenges in its clinical use, including potential side effects when combined with small molecule chemotherapeutics and uncertainties in human applications of HBO-enhanced nanomedicines and probiotics. They conclude that further preclinical and clinical research is needed to ensure the safety and efficacy of HBO in future cancer treatments. However, hyperbaric oxygen therapy has not been shown to enhance tumor growth. Now, what about the virus? You guys know which virus I'm referring to. How does it impact that? In a randomized controlled trial published in 2024, hyperbaric oxygen therapy significantly improved cognitive, psychiatric, fatigue, sleep, and pain symptoms in long virus patients 1 year after their last hyperbaric oxygen therapy treatment. 31 patients with post-virus cognitive issues underwent 40 daily HBOT sessions and were followed up more than a year later. Results showed that improvements in quality of life, sleep quality, and neuropsychiatric symptoms persisted long-term. Pain severity and interference also remained significantly improved. Overall, HBOT led to sustained clinical improvements in long virus symptoms a year after treatment. So how do we actually use HBOT? The use of hyperbaric oxygen therapy requires a personalized approach tailored to individual needs and goals. One important distinction is between soft chambers, which typically provide lower pressures, and hard chambers, which can deliver higher pressures and are often used for more intensive treatments. Different pressures produce varying physiological effects. For example, lower pressures may promote general wellness, while higher pressures might be required for specific medical conditions like non-healing wounds. However, some individuals are sensitive to higher pressures, underscoring the importance of careful adjustment to avoid discomfort or adverse effects. While people can purchase hyperbaric chambers for personal use to ensure safety and maximize benefits, it should be administered under the guidance of medical professionals experienced in this therapy. These experts can develop tailored protocols, as HBOT regimens differ significantly based on individual health status, treatment objectives, and response to therapy. Now, what about as it relates to safety? Obviously, these are pretty sophisticated devices, so what about how they can be used safely? Hyperbaric oxygen therapy is generally considered safe when administered by trained professionals, but it is not without potential adverse effects, which should be carefully monitored to ensure patient safety. Ear discomfort, including barotrauma, is the most frequently reported side effect, particularly at pressures exceeding 2.0 ATA or during prolonged treatment courses of more than 10 sessions. Claustrophobia, though rare, can also occur, especially in patients unfamiliar with enclosed spaces. According to a systematic review and meta-analysis, adverse effects were significantly higher when higher pressures and longer treatment durations were used, emphasizing the need for tailored protocols. Despite these risks, complications such as oxygen toxicity or pulmonary injury remain uncommon, particularly when air breaks are incorporated into sessions. Studies have also noted significant therapeutic benefits such as reduced pain and enhanced healing in conditions like venous ulcers and post-traumatic wounds, which highlight the overall value of HBOT when safety measures are adhered to. That pretty much wraps up today's video on hyperbaric oxygen therapy. I'm leaving a link in the video description down below if you actually do want to learn more about HBOT therapy. That's it from me today, guys. I look forward to seeing you in the next video.